Anemia, a problem of nutritional deficiency. Does your reflection in the mirror look pale? Do you always have cold hands and feet? These could indicate a problem with anemia. Hello, this is Jenny. Today, let's delve into this common condition estimated to affect 1 in 3 people globally, significantly impacting overall health and, in severe cases, being life-threatening. Anemia is a blood disorder characterized by a deficiency in the number or quality of red blood cells. It is diagnosed by low levels of hemoglobin, the main protein in your red blood cells that gives them their color and is responsible for carrying oxygen throughout the body. Without enough healthy red blood cells, your tissues and organs do not receive sufficient oxygen. Leading factors. Some types of anemia are inherited, but people may also acquire or develop the condition during their lifetimes. The underlying causes of anemia are diverse and can stem from various factors. Genetic conditions. Some forms of anemia, such as thalassemia, sickle cell anemia, Diamond-Blackfan anemia, and Fanconi anemia, are inherited and passed down through genes. Infants may have these conditions from birth. Additionally, mutations in certain genes that regulate iron levels can cause iron-refractory iron deficiency anemia. Poor diet and nutritional deficiencies. A diet lacking in essential nutrients, particularly iron, vitamin B12, folate, and vitamin C can contribute to anemia, as these nutrients are essential for red blood cell production. Health situations. Certain chronic diseases can cause anemia. Cancer, chronic kidney disease, inflammatory disorders, autoimmune disorders, and infections like malaria can interfere with the production or lifespan of red blood cells. Conditions like stomach ulcers, ulcerative colitis, and gastrointestinal bleeding can increase blood loss. Gastrointestinal disorders such as celiac disease may lead to poor absorption of essential nutrients. Problems with the bone marrow, such as lymphoma, leukemia, myelodysplastic syndrome, multiple myeloma, or aplastic anemia, may disrupt the normal formation of red blood cells. Environmental factors. Exposure to lead and certain chemicals increases the likelihood of anemia development. Immediate triggers. Heavy menstrual bleeding and higher blood supply demands during pregnancy make women at higher risk of iron-deficient anemia. Sudden blood loss from injuries, surgeries, trauma, or conditions like peptic ulcers or hemorrhoids may also lead to a sudden onset of anemia. Types of anemia. Anemia can manifest in different forms, each with its unique characteristics and impact on daily life. Some forms, like the mild anemia that occurs during pregnancy or is caused by diet, medications, or a medical condition, are common and treatable. However, some types of anemia can be chronic and may reflect a serious medical condition. Iron deficiency anemia. This is the most common type, caused by a lack of iron, which is essential for hemoglobin production. Symptoms may include fatigue, weakness, pale skin, and shortness of breath. Vitamin deficiency anemia. Megaloblastic anemia. Deficiencies in vitamins like B12 and folate can impair red blood cell production, leading to megaloblastic anemia. This type of anemia can cause fatigue, cognitive issues, and numbness in the extremities. One of the causes of vitamin B12 deficiency is pernicious anemia, an autoimmune condition that prevents the body from absorbing vitamin B12 properly. Aplastic anemia. In this rare but serious condition, the bone marrow fails to produce enough new blood cells, including red blood cells, white blood cells, and platelets. It can result in fatigue, frequent infections, and an increased risk of bleeding. Inherited anemia. Some forms of anemia are inherited, including conditions like sickle cell anemia and thalassemia, as well as certain types of hemolytic anemia. They involve genetic abnormalities in the structure or production of hemoglobin, or red blood cells being destroyed prematurely, causing chronic anemia and various complications. Symptoms. Depending on the underlying cause and severity, anemia can manifest a wide range of symptoms. Some of the most common symptoms include fatigue. Feeling fatigued, weak, and tired with daily activities is often the most noticeable symptom, as organs don't receive the oxygen they need to function properly. Pale skin, pallor. A pale or yellowish skin color may occur since hemoglobin levels are low. Shortness of breath, dyspnea. You may experience shortness of breath caused by insufficient oxygen transport, even with mild activity or at rest. Headache. This is a common symptom resulting from reduced oxygen supply to the brain. Dizziness. Sudden drops in blood pressure can lead to dizziness, lightheadedness, or a feeling of nearly passing out, especially when standing up quickly. Cold hands and feet. Poor blood circulation from anemia can make the extremities feel cold. In more severe cases, numbness and tingling of the hands and feet may occur. Heart palpitations. You may experience unusual sensations of having a fast beating, fluttering, or pounding heartbeat. Cognitive impairment. This includes problems concentrating, thinking clearly, and sometimes irritability. Other symptoms that individuals with anemia may experience: loss of appetite, pain, including in the bones, chest, abdomen, and joints, frequent infections, pulsatile tinnitus, rhythmic thumping, whooshing, or throbbing sound, in one or both ears, blue color to the whites of the eyes, brittle nails, desire to eat non-food items, pica syndrome, sore or inflamed tongue, mouth ulcers, problems with growth and development for children and teens. Self-assessment. The signs of anemia can be subtle, as its symptoms are similar to those of many other disorders. However, it can be helpful to perform some simple self-examinations to check for potential signs of anemia. Check your eyelids. Pale inner eyelids can be an indicator of anemia. Look closely in the mirror and quickly pull your lower eyelid down to examine the inner lining of the eyelids, or palpebral conjunctiva. The color is usually pinkish red or dark pink in people with healthy red blood cell and hemoglobin levels. However, if you have anemia, your inner eyelid appears pale pink, yellowish, or even whitish in severe cases. This paleness indicates a lack of healthy, oxygenated blood flow. Check your lips. Anemia tends to make you appear pale, which is often most noticeable in the lips. If your lips seem paler than usual, that's an indicator of anemia. This tip works for people of all skin tones by comparing it to your typical lip color. Check your nails. Your nails, particularly the nail beds, the little half moon near the cuticle, can also turn pale when you're anemic. While these self-checks may provide clues for potential low levels of iron or anemia, a medical evaluation including a complete blood count, CBC, test by a healthcare provider is necessary for a definitive diagnosis. Common solutions for anemia. While anemia can have genetic or chronic origins, most cases exhibit mild symptoms and are often short-term issues that can be effectively treated. Managing anemia typically involves addressing the underlying causes and replenishing the body's nutrient reserves. Here are some common solutions. Dietary changes and supplementation. Addressing nutritional deficiencies through a well-rounded diet and targeted supplementation is a critical aspect of managing and preventing anemia. Nutritional interventions not only tackle the root cause but also promote overall health and well-being. Key nutrients that play a vital role include iron. Iron is crucial for hemoglobin production and oxygen transport in the blood. Rich dietary sources include red meat, poultry, lentils, spinach, and fortified cereals. Vitamin B12. Essential for red blood cell formation, DNA synthesis, and nerve function, vitamin B12 is primarily found in animal-based foods like meat, fish, eggs, and dairy products. Folate. Vitamin B9. Folate is essential for cell growth and division, including the production of new red blood cells. It is abundant in leafy green vegetables, citrus fruits, legumes, and fortified grains. Vitamin C. An antioxidant that enhances iron absorption and prevents deficiency, vitamin C is found in citrus fruits, bell peppers, and broccoli. Copper. This trace mineral aids in the absorption and utilization of iron. Good sources include nuts, seeds, whole grains, and shellfish. Comprehensive supplements. Consider taking a comprehensive health supplement that includes a balanced mix of vitamins, minerals, and trace elements to ensure optimal nutrient intake. Medication. In certain cases, medications may be prescribed for anemia, such as erythropoietin stimulates the bone marrow to produce more blood stem cells. Immunosuppressants, such as corticosteroids, may be used for anemia associated with autoimmune disorders to suppress the immune system's attack on red blood cells. Medical treatments. For severe or life-threatening anemia, medical interventions may be necessary, including intravenous, IV, iron infusion treatment. This treatment targets iron deficiency anemia by directly replenishing iron stores through intravenous delivery, stimulating new red blood cell production. Blood transfusion treatment. Used to manage various types of anemia and significant blood loss, transfusions replace red blood cells in the bloodstream, restoring adequate levels of blood components. Stem cell, bone marrow, transplant. Replacing unhealthy blood stem cells with healthy ones through a transplant can be a treatment option. Surgery. In cases where internal bleeding contributes to anemia, surgical intervention may be necessary to address the underlying cause. Anemia is a widespread condition with various underlying causes, and nutritional deficiency is a significant contributing factor. Common symptoms include pale skin, cold extremities, dizziness, and fatigue. Ensuring an adequate intake of essential nutrients such as iron, vitamin B12, folate, vitamin C, and copper through a well-balanced diet and comprehensive supplementation is vital in aiding the prevention and management of anemia, as well as promoting overall well-being. Thank you for watching. Please subscribe, like, and share this channel to receive more updates on health and anti-aging. Bye for now, and see you again soon.